Hello, my name is Dr. Eric Prosher. I'm a psychologist and I represent Jesse Brown VA Medical Center. And today we have a special show. We're featuring some of our community partners. And the first community partner is Andrew McLaughlin from the National Able Network, Veterans Forward. You're watching a live call-in interactive program brought to you by CAN TV 21. So over the next 25 minutes, please call in with your questions at 312-738-1060. Our phone lines are now open. So, Andrew, thank you for coming on.
Thanks for having me in here.
So, why don't we begin by telling me a little bit about the Veterans Forward at the National Able Network. What is the National Able Network and
Sure.
the Veterans Forward?
So just a little bit about the National Able Network. I mean, we've been around since 1977. We started out with a seniors program. The Veterans program was founded in 2003, and we now serve 500 plus veterans a year, and we're working on increasing that number. We work with veterans from every background, experience level, education level, and skill set. So personally, I'm a veteran, and I've been to interviews prior to taking this job where people interview me like I'm a specialist, basically a lower level ranking when I was in the military. So they interview me in that role, but I also have a master's degree. So I definitely make my job, a big part of my job is communicating all of these roles, officer to enlisted, all the way down through the ranks, and all of the education backgrounds and experiences. I make sure that the veteran is able to communicate what makes them the most employable for any given job, because it's kind of hard for the employer to see that. They don't speak our language, really. So a little bit more about the Veterans Program. We're more than, in terms of our veteran-specific department, we're more than half veterans, so we bring in a lot of perspective like mine. And like I said, we're working on, giving more visibility to the program. We offer one-on-one career counseling, job skills training, vocational training, and also exclusive job leads. So we're also working on building our partnerships a little bit too.
That's kind of where I was going to go next. So if I was a veteran coming to your office, what would I expect? How would it work?
Okay.
And where can I find you?
Okay, so if you're a veteran coming into our office, we're actually in the CTA building at Able headquarters at 567 West Lake Street. That's the only place that the Veterans Program is, but we have 5 offices across the Cook County region, and we also operate in 5 states. So anybody, at least for now in Illinois, any of those offices can refer veterans on to us where we're at now. On a given week, I'm at the Jesse Brown VA. Actually, I see
in our post-deployment
Dr.
clinic
Prosher there
at 820 South Damon Avenue.
Mm-hmm.
So that's on the 10th floor in the Damon building, and you're there what days?
I'm there every Thursday from 1 to 4 p.m.
Every Thursday from 1 to 4 p.m.
Mm-hmm.
Jesse Brown, 820 South Damon Avenue. So if you've just joined us, you're watching a live call-in interactive program brought to you by CAN TV. We have a special guest from one of our community star partners, and that is National Able Network. And Andrew McLaughlin here is talking about the Veterans Forward program. So you were just naming some of the services. Could you repeat some of the services one could expect from a veteran coming into your office?
Yeah, sure. I'll try to make it concise. So, and something I want to make clear throughout this whole conversation is maybe you're not a veteran tuning into our program. Maybe you're a veteran. You're the parent of a veteran, or you're even the child of a veteran.
Excellent point.
Any veteran that you know that's looking for employment, we are a workforce development agency. Send them my way. So some of the things we offer is one-on-one support. So if I see you at the VA, that's the best place to catch me one-on-one. If you're in Operation Iraqi Freedom, Enduring Freedom, or New Dawn veteran, you can catch me there. So we offer one-on-one support. We offer wraparound assistance. So we realize that a lot of state and federal agencies, they're not able to offer a holistic support system for families. So something we pride ourselves on is if we're going to help you on the job search, we're also thinking about your family in the context of where we're going to put you in the job. So
that's a good point.
Thank you. We also have job skills training. So we offer a job readiness training. So I could tell you how to make a resume, and I might not have the research behind it, But in this case, we have, with the Department of Labor grant, we put together some pretty extensive and serious research-based training programs to help you get a job and help you target your resume, target a cover letter, general job search assistance, and even use how to use social media effectively. And that's something we're increasingly working on, is helping veterans get social media presence. Sorry, that's a
Yeah. So, is there maybe, do you have a success story with a veteran that's been through your program that you could share?
Sure. We're working on our partnerships right now, and we're revisiting some things. But I would say that some of the success stories is, as long as a veteran is staying in contact with us, we've been able to place them. There's a lot, there's a variety of barriers to employment to overcome. We work with we work with some veterans that have felonies, and so some agencies are not able to hire them, but we keep working with them to look for something, and we're working on building those partnerships as well.
So if potential employers are looking to get involved and hire a veteran, would they contact your agency? And
Yes.
How would that work?
Well, I would suggest that you contact me personally. But for right now, you can easily get a hold of us by calling the number located on the card here. That's 855-994-8300. And I'm going to be honest, because some federal mandates have changed, I know that a lot of organizations are looking to hire veterans, and that's something that we can not only, one, give you training on to help you hire veterans more successfully, but to also to get veterans hired and meet your goals, but also meet the goals of veterans who are looking for a job. And personally, being a veteran myself, Army, got deployed with 3rd Infantry Division to Iraq, 11 Bravo. Not many skills I can take from that, although I'm also a rhetorical communication kind of person. That's what my background and degree are in. I can come up with skills for 11 Bravos, but sometimes it's hard to communicate those. So I'm definitely all about helping a veteran communicate how they are employable. Excellent. And making them employable.
Well, in terms of communication, what do you think one message you would want to tell employers about hiring veterans?
Okay. I would say number one, veterans they're employable, and they are, they're great employees, period. Okay, so they learn a lot of the foundational skills. Integrity, accountability, those are two of the most important things that you can expect from any employee. So if they have integrity and they have accountability, they're never going to drop the ball on anything they're going to do and come in. So that's just foundational. They're not going to call in sick. I worked 2 years teaching college and never once called in sick. People should use their sick days, but I think that you can definitely expect a lot from veterans in any setting.
I've worked with I was a Navy veteran myself and worked with a couple of devil dogs, but I know and we have a devil dog coming up later on this program. What was the old saying? If you're 5 minutes, if you're not 5 minutes early, you're late, right? Or something like that. 5 minutes late.
That's good.
So, is there a popular career path that you're seeing trending right now in your organization?
Thank you. I mean, we work hand in hand with Department of Labor, other state and federal agencies on a lot of things. So, a lot of our programs are research-based. So, at National Able Network right now, unrelated to veterans, but we're post 9/11 GI Bill certified. So you can use that to get these certifications, which I'm about to talk about. So, at National Able Network, like I said, we're part of that, but we also have Able Institute inside of that. In our Able Institute, we have IT Career Lab, where you can get 3 certifications, including Cisco certification, Cisco networking certification, Network Plus, and CompTIA certification.
Sounds like we have a caller.
Oh, great.
Andrew.
Perfect timing.
All right, great. Hello, caller.
Hello.
How can we help you? How are you?
Good. Post 1052. I have a question about Vietnam vets. Why is it so hard for a Vietnam vet to get a job? And trust me, my husband has tried, and he's finally retired, and we're still fighting for post-traumatic stress. Let's put it this way. Our government drafted half of these boys, and when they came back, they had nothing. And to this very day, what I'm working with and seeing through my husband and all the veterans, they have nothing still. Mm-hmm. And now they're getting too old to be into the working. And you're right. You hire a veteran, they're never late, they're on time, and they do their job better than some of these people that are out here right now. They can't even keep a job. that they should be given to a veteran that can do a better job. But my question is, you're talking about Vietnam vets. I mean, you're talking about the ones that come back. What about the ones that have come back in 68, 69,
Right.
7, and then have been through hell? All
Yeah.
I hear is people telling me that, they were ordered to do things in Vietnam. We're not going to get into it. Thank God there's a Dr. Walsh at the center to take care of people's needs there at Jessie Brown. She's great. But still, my issue is they still can't find jobs.
Jobs, yeah.
How do we do it? I mean, they're getting too old.
And very important. That's an important point that you make. That not only, I mean, what you're talking about is there's competition. This is our economy has been in a
real bad
low
economy
for
right
a
now.
long time now, and it's not just a struggle for new vets, and it's not just a struggle for old vets, but it's a struggle across.
Well, my thing
lines.
is we should be putting emphasis on the ones that were drafted. They didn't ask to do this with their government.
Yeah.
They
Can I
were put in a
interject?
spot to do this. They did it, and when they came back, they were called all kinds of
absolutely.
terrible names.
Ma'am, well, the great thing about the National Able Network is they do work with Vietnam vets.
Yeah, we work with Vietnam vets, and we have a seniors program, and basically I mentioned that because we have training for people 55 and older. But I want to emphasize that because I deal with a lot of Vietnam vets that are suffering age discrimination, just like any other older person or anyone 55 and older trying to return to the workforce. There's age discrimination. An employer is going to look and say, how many more years do we have left? Can you come into this program and retire? Or can you come into this occupation and retire? So I can help, design something, design a resume that's going to overcome age discrimination, or at least get, on the way there too.
Well, and then I'm looking at the history of their medical, post-traumatic stress, Agent Orange. I mean, as soon as you look at that and they want to hire somebody medically, they're going to look at it and say, should I hire somebody with PT,
Well, actually, that's something we talk about in our job readiness training, too. We go over a list of why employers want to hire veterans and a list of why they don't want to hire veterans. And honestly, that's on the employers. And so part of our ethics training is to train the employer to be indifferent to this fact, because we've got to talk about how this person is as an employee outside of that context, which is a really personal context. So that's definitely part of our ethics training, but we're also coaching the veterans to kind of get past that kind of questioning, which is really it's too personal. As an employee of the state, of the federal government, doing your job, you should not be asked any of these intrusive questions.
It's private information protected by the law.
Well, it's almost like the HIPAA Act.
Exactly. So,
Okay.
wow. So
I'm
how
just
can
worried
someone...
Because I do have a lot of people that have re-upped in service, and they want a job, and they have been putting their foot forward, and, my nephew's just getting frustrated.
Send him my way.
He's young, he's in his 50s, and he still can't find anything.
Great.
Where are you located at, though?
We are at 567 West Lake Street, right off the Clinton stop on the green and pink line.
And you're not across the street from Jessie Brown?
Negative. But I'm there every Thursday from 1 to 4 p.m.
1 to 4 at 569?
We're at 567 West Lake Street. That is our address for National Able Network.
Thanks.
And our contact information is also on the screen. I want to take this time to thank Andrew for coming on the show and answering questions, and we'd love to have you back in the future. And for the veterans out there, come see Andrew on
Thursday, 1 to 4.
Thursday, 1 to 4.
Okay. Thank you, Dr. Prosher, and thank you, rest of the Jessie Brown staff. It's been a
Okay.
pleasure.
Thanks. So next we have another one of our community partners, and this is Jacques Rene Hebert, and he is from ChildServ.
Yes, sir.
So we did a magic act. Voila.
Yeah.
Welcome.
Thank you so much.
ChildServ. So could you tell us a little bit about the ChildServ organization and what you guys are doing for veterans as our community partner?
Absolutely. So ChildServ is a nonprofit child welfare agency. We've been around since 1894. We have foster care, adoption, transitional living programs, and group homes. So we've been working with at-risk children and families for a long time.
A long time.
Yeah.
And so what a great collaboration with Jessie Brown in the sense that, traditionally services for our veteran population has just been for the veteran population, and sometimes dependents and spouses get left out of the equation. So,
Absolutely.
you know what the old saying is, right? It takes a village to treat a veteran, something to that effect. So
I think it goes like that.
so what are there any specific criteria that makes someone eligible for these services?
We really, the only criteria that we have for our services is really that they're military connected. So we serve, and it's really a great opportunity for these community organizations like ChildServ to work with Jesse Brown and serve those that that the VA just doesn't have the capacity to serve. So, for instance, that would include siblings of a veteran or military personnel, National Guard or reservists that have served less than 2 continuous years of active service, parents of a veteran, of course, the children, families, and then significant others, so baby mamas, baby papas.
Oh, great. So for those of you that have just joined us, you're watching a live call-in interactive program brought to you by Ken TV 21. So call us with our questions. We have a special guest, Jacques Hebert from ChildServ, and we're talking about the collaboration with our community provider here and working with children and parents of veterans. And the number is 312-738-1060. So what is the process of getting enrolled in the ChildServ program?
Well, really, the process is just to reach out to me. I can be reached at military@childserv.org. For our clinical services, you can call 773-239-8984. And then to reach me, you can call 773-867-7321.
Great. Are there any success stories you'd like to share with us about your program and the work you've been doing with veteran families?
Well, we can't share too many specifics.
You can't get too personal. Yeah,
right,
I
right.
understand.
But we've helped many families get ready for deployment. We've helped families kind of make sense of the reintegration back into civilian life. And of course, there's some more serious stories of families who are dealing with post-traumatic stress or other forms of military stress with their families and children. That's really where ChildServ sees its niche is with families with children.
Okay. So,
and that includes grandparents raising grandchildren. We also have a program called Grand Family Support that provides affordable housing to grandparents raising grandchildren.
so on your screen are some of the services that are available. Maybe you can talk to us about a little bit of each of those.
Absolutely.
Early childhood program? Wow.
So Armor Counseling is our counseling program, and that serves individuals, it serves couples, it serves families, and it serves children.
Is there a cost associated with that?
No cost whatsoever.
Okay.
All of our services are free for military and veteran families.
Wow.
We also have early childhood programs, parent empowerment program, and home instruction for parents of preschool youngsters. These are the PEP is a program for parents with children 0 to 3, and HIPPY is a program for parents with children 3 to 5. And these programs are really great for rebuilding that parent-child bond that many times can be hurt by long periods of separation or even loss in some cases. And when there's one parent left and the relationship has to be strengthened. Then we also have a new program. It's our Affordable Homes for Heroes program.
Oh, tell me about that.
Yeah, we're really excited about it, actually. It's a partnership with Neighborhood Housing Services and Home Depot. And what we've done is taken 3 homes in West Humboldt Park neighborhood. We've totally gutted them, rehabbed them, and now are offering them to military and veteran families with children for their 2-bedroom apartments for $700 a month. And it's really cool because they're this program is really unique. We've also built financial literacy and personal finance and property management course to go along with that. So all families will be learning how to budget, how to save, and we'll be working with our partner neighborhood housing services to help these families become first-time homeowners.
Wow. So you have 3 homes. How do you go about choosing who gets placed in this program?
So
Is it competitive?
We just opened
started?
for intake, and I mean already we've had at least 10 different inquiries, and there's only 6 units. So yes, it is going to be very competitive. Really, the primary eligibility criteria is that they be veteran families or military families with children.
Oh.
That is our biggest criteria.
Okay. Well, let's go over the last one is the Illinois Military Families Initiative. What is that?
So the Illinois Military Families Initiative is our community engagement side. And through the IMFI, we run 2 community action teams, one in Palatine Township that serves the northwest suburbs, and one in the Austin community of Chicago that serves Austin and West Side. And basically what that does is it brings elected officials, business leaders, service providers together to basically put on awareness building activities in those communities to pull the veteran families, out of the woodwork. I mean, that's one of the biggest problems is serving these families.
How do you find them?
How do you find them?
Right.
Many times they don't even know the resources that are available for them.
Exactly.
So that's the goal of those teams.
Great. Sounds like we have a caller.
Yeah. Hi.
Hi.
I'm not actually a vet, but my brother is, and
Hello? Caller? Hello, caller?
Hi.
Hi.
I want to know, how does ChildServ's homeless program differ from the VA's homeless program?
Oh. Okay.
Well, you could probably answer more about what the VA's homeless program is than I can.
Okay.
But our program isn't necessarily a homeless program. It's a program for families that are struggling. They could be homeless. They could be at risk for homelessness. But it's really, the whole idea is to provide a foundation of affordable housing while providing a continuum of care of social services.
And it's a great complement to Jesse Brown's homeless program, which, I'm not an expert in it, but I know that General Shinseki, the leader of the VA, has vowed to end homelessness for veterans and has put a lot of funding and backing behind the programs at the VA. And we have a continuum of homeless care services, including the HUD-VASH program, which provides vouchers for veterans to get rent-adjusted living facilities.
How about, do they help veterans with other than honorable discharges?
ChildServ?
Yes.
Absolutely. There's the only eligibility criteria that we have for our services is really that the family or the individual has a connection to the military, that they've been affected by the military service of a loved one or of somebody close to them.
We are running out of time. Unfortunately, we got a couple more callers, but I'm sorry.
Thank you.
Thank you for calling. We'll connect next week. Thanks for tuning in. I'm Eric Prosher from Jesse Brown VA. This is Jacques Rene Hebert from ChildServ. I want to thank Andrew McLaughlin again from National Able Network. And you've been watching Ken TV 21. To learn more about our organizations, give us a call. And please stay tuned for the next show. Goodbye for now.